An HIV rash is a skin irritation that occurs in people who have the virus. It can cause itching, red or purple discoloration, and even pain. It is a common symptom for people with HIV, occurring in both early and later stages of the infection. For many, it may be one of the first signs of having the virus. An HIV rash can be caused by the HIV infection itself, as well as other infections or medication. It's important to have your doctor check out any rash that may be related to HIV. The HIV rash typically appears as slightly raised areas on the skin. It is commonly found on the trunk or face, and can also occur on the hands and feet. The rash may appear red on individuals with light skin, and more purple on individuals with dark skin. When your body fights off the HIV virus, it can cause a rash to appear on your skin. This rash is often accompanied by other symptoms such as fever, fatigue, swollen lymph nodes, sore throat, headaches, muscle aches, and diarrhea, which typically last around 2 weeks. Because these symptoms can resemble those of other common conditions and may go away quickly, many people may not realize they could be signs of an HIV infection. If you have a rash and suspect you may have been exposed to HIV, it's important to see a doctor right away. A blood test can easily determine whether you have the virus, and early diagnosis allows for earlier treatment. Medications can help control the virus, prevent the infection from developing into AIDS, and help you stay healthy and live longer. They can also reduce the risk of spreading HIV to others. HIV weakens the cells that usually fight off infection, which can lead to rashes over time, especially if HIV medicines are not taken. Some infections that cause rashes in people with HIV include syphilis. This sexually transmitted disease can cause a rash on the soles of your feet and the palms of your hands, 2 to 8 weeks after infection if not treated right away. Molluscum contagiosum. This viral skin infection causes small, flesh-colored bumps that can appear anywhere on the body, and can be more difficult to treat for people with HIV or AIDS. Treatments for the HIV infection can help by boosting the immune system. Herpes viruses. People with HIV and AIDS are more susceptible to flare-ups of herpes viruses, such as shingles, which can cause a painful skin rash. Antiviral medications can help treat these rashes. Kaposi sarcoma. This is a type of skin cancer that looks like dark spots and usually happens in people with AIDS. If you notice a rash along with symptoms like fever, fatigue, headache, muscle pains, upset stomach, vomiting, and belly pain, it could be a hypersensitivity reaction to certain HIV medications. Some medications that can trigger this reaction include abacavir, Ziagen, raltegravir, isontress, dolutegravir, tivicay, maraviroc, Selzentry, and nevirapine, Viramune. If you experience fever, a painful red or purplish rash, or blisters that spread on your skin and around your mouth, nose, and eyes, it's important to seek medical help right away. These could be signs of Stevens-Johnson syndrome, a severe and life-threatening form of hypersensitivity reaction. Always talk to your doctor before stopping any medication, as rashes often go away after you stop taking the drug. When it comes to treating an HIV-related skin rash, the first step is to determine the cause. If it's a reaction to a medication, stopping the medication may help the rash to go away. Your doctor may also prescribe antiviral or antiretroviral medications to help relieve symptoms. In addition to medication, there are some things you can do at home to help manage the rash. Talk to your doctor about using over-the-counter medication like antihistamines or hydrocortisone to help with itching. Avoid taking hot showers or baths. Stay out of direct sunlight to prevent further irritation of the rash.